I know Phyllis can't stay for too long tonight, so we're going to get started in just a moment. We get Phyllis up. Once Kelly's here, we'll get Kelly up. And we will carry on the conversation we were having last week about perimenopause and menopause. Oh, gosh. Symptoms. Yeah, I spoke to her earlier on today. She said she's coming. But something might have come up. Okay, let's get Phyllis in the box. Just sent you an invite, Phyllis, for you to come up. Yeah, and keep tapping, guys. Keep tapping the screen. Hey, Jess, welcome. Thank you for the heart me. That was very kind. Thank you if anyone else has sent a heart me and I've missed it. All right, let me turn my camera on. Hey, Phyllis.
Hey.
Oh, let me turn my volume up. You're very, very quiet.
Oh, am I doing it? Hold on. Let me see if
No, it was me. It was me, not you.
Okay. I wasn't sure.
I had the volume all the way down. I was like, oh, you sounded like you were down a well. Down a well. Hold on, let me see if I can turn this camera around. It is so hot. Oh, it's not what I intended to happen. See my brick wall? Let's click on enhance. Turn on the camera. It's on already. Can't see how to rotate my camera. Oh no, and that is the worst patch of the whole garden as well that it's on. Let's push it up there. Kelly's here. I can't figure out how to turn the camera around. Hold on, I'll tell you what I'll do. Sorry. Guests. Let's change the format, that might help me. Switch. It's not helped me at all, is it? Sorry, everyone. Don't worry, I was late as well, Kelly. Don't worry, I'll get you up in a second. Hold on. Trying to sort my camera. Trying to turn the camera on. Thought my brain's just stopped working. Right, it's not in there. Flip camera. Hidey, 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 hi. Hello, everybody. There we go. And I don't know why that perimenopause sign is stuck halfway down there. That's not supposed to be happening. Effects. Sorry, everyone. Sorry. Let's try that. Oh, it's just putting it over my face. Let's try this one. There we go. Bada bing, bada boom. We got there. Sorry for the delay, everybody. Hi, White Wolf. Heidi, hi. Heidi, Heidi, hi. Let's get Kelly in the box. Thank you, everyone, for coming to this menopause and perimenopause live. Hi, Mrs. Doubtfire. Hi, darling. Yes, we did this last week and it was such a lovely live and there was lots of questions that we didn't actually get through and all of that good stuff. So I thought we'd do, oh gosh, the boobs are boobing. I thought we'd do a part 2 because it's such an important topic and it was such a lovely live. So I've got Phyllis and Kelly back. Evening, ladies. Are you both okay?
Good evening. Yeah, all good here. All good here. Hot like everybody else, but that suits me.
Yeah.
You love the
All
heat.
good. I don't like the heat, so I can't say that it suits me. But yeah, I'm really sorry I can't stay to the end today, but
Okay.
I'll stay as long as I can.
And Kelly's the same as well. So Is it worth me reading through the symptoms again, or should we just get some questions? Oh, Mrs. D, thank you for subscribing for 2 months as well. Love Mrs. Doubtfire. Everyone make sure you follow Mrs. Doubtfire because she's just the best. Thank you so much. You want me to go through the symptoms? All right, I'll read these quickly and then we'll open up for some questions, and I know that these two will add some extra symptoms as well. So thank you so much, Mrs. Doubtfire. This is from NHS's website with regards to menopause, and these are some of the common symptoms of menopause and perimenopause. Menopause and perimenopause symptoms can have a big impact on your daily life, including relationships, social life, family life, and work. It can feel different for everyone, and we noticed that last week. Everyone has a different experience. You may have a number of symptoms, or you might have none. And symptoms usually start months or years before your periods stop. And this is called the perimenopause. And I'm going to try and remember to call them your monthlies rather than periods. Now, changes to your monthlies. The first sign of the perimenopause is usually, but not always, a change in the normal pattern of your monthlies. So, for example, they may become irregular, and eventually you'll stop having monthlies altogether. And so what are the mental health symptoms that are pertaining to menopause? Some common mental health symptoms of menopause and perimenopause include changes to your mood, like you might have a low mood, anxiety, you might have mood swings and low self-esteem, and you may also have problems with memory or concentration, or also known as brain fog. And there are some physical symptoms too when we're talking about perimenopause and menopause. So some common physical symptoms of menopause and perimenopause include hot flushes. This is when you suddenly have feelings of being hot or cold in your face, your neck, your chest, which can also make you feel dizzy. You might have difficulty sleeping. Yeah, dryness is another one. You might have difficulty sleeping, which may be a result of night sweats and make you feel tired and irritable during the day. You might also have palpitations when your heartbeat suddenly becomes more noticeable. You might also experience headaches and migraines that are worse than usual. You can also get muscle aches and joint pains, and there will be changes in your body shape and weight gain. There are also skin changes, which include dry and itchy skin. You might have a reduced sex drive. You might have foo-foo dryness, you know what I mean, and pain. You might also get some itching and discomfort during sex. You can also have symptoms of recurrent UTIs, and you can also have sensitive teeth, painful gums, or other mouth problems. And it says the symptoms can last for months, or they can last for years, and they can change with time. So, for example, hot flushes and night sweats, they may improve, and then you may develop low mood and anxiety. And some symptoms, such as joint pain and foo-foo dryness, can carry on after your periods have stopped. It goes on about contraception, but I'm going to leave that bit for now. I know it's all so much fun. So those are some of the common symptoms. I didn't want to say the word in case I got a nana, Mrs. D. So we're going for foo-foo tonight. So, ladies, did you want to add in any other additional symptoms that weren't on that list? Dinkles!
Aching joints, swollen joints, hair thinning, hair loss. I mean, I haven't got any good ones to add. I think that's, you know, I'd love to be flying in and going, oh, but this happens and this is a great thing. But yeah, and I'm just seeing, it does flare up other coexisting conditions so that people end up quite confused about what's causing what.
Oh,
Sorry.
can't hear you, Remy.
Oh, can you hear me now?
I can hear you now. Yeah.
Sorry. Thank you. And the other thing that came up last week when we was talking about age, and there was somebody in the live, wasn't there, who said that they got theirs at age 27 after was it after sort of a radical hysterectomy or something? I
Yeah.
It was.
Yeah. Yeah.
So,
Yeah. I mean, some of the other things that you might get with it are tinnitus,
yeah.
dry mouth. You've said some of the others. You've said the changes in hair and skin. You see weight changes, breast tenderness. Yeah, quite a few other ones. And as Kelly's just alluded to there as well, that difficulty and what you were just saying, that difficulty of determining whether or not some of the symptoms are either of perimenopause or menopause, because they're often very similar symptoms that you also can get for women as they're going into their 40s, for example. So they might get hypothyroidism, they might get parathyroidism, and some of those symptoms are very, very similar. They also, unfortunately, some of the cancers, so ovarian and endometrial cancer, might bring on some of these similar symptoms. So it's always really, really good. And I think this is one of the things I didn't probably mention enough last week, is that if you do have strange symptoms, don't immediately say it is the menopause. Do get it checked out. Go and see a clinician of some kind to get it checked out to determine whether or not that is what it is.
Yeah.
They can't tell it from taking a blood test, because a blood test is not going to tell you whether or not you're menopausal or not menopausal, because of the fact that those hormones fluctuate. But it's more that they will be excluding other things.
So how does somebody get the diagnosis that they are either in perimenopause or they're in menopause, if it's not just blood tests?
It is those the collection of symptoms, really, because unfortunately, one of the things that often gets done, which we spoke about last week, is that women will be given antidepressants because that's what they assume that they are when they come in at that age. Excuse me. And it isn't necessarily that that's what it is. It's more likely that it's come from those menopausal symptoms that have made them just that little bit, feeling more down, all of the things that come with it. But really, the only way to diagnose is when your periods, when you've got that change in, your monthlies.
Apparently, we've been told we can say medical terminology.
Oh, right, okay.
Ooh.
From a trusted source, Mrs. Doubtfire.
TikTok's getting grown up.
Thank goodness.
It was me trying to change all the words there. She says we can. So,
okay. So the periods which will change, and sometimes it means that they get heavier, sometimes it means they get lighter, sometimes it means that they become more sporadic. So there are all different changes that can happen, but it is linking those to the other things that you're getting as well.
Yeah, thank you for that. That was amazing.
I've seen Sam. Sorry, Rem. You just have to shush me. You know that. You should know that by now.
I was just going to tell everyone to keep tapping, and please, can you keep sharing this to people who should be here and listening to this conversation for me? Sorry, Kelly. Go on.
That's okay. I've just seen Sammy ask a couple of times what's the most common age for perimenopause, menopause. And there is not an exact science, Sammy. So a lot of women, probably 40s, would be more common, but don't rule it out if you're somewhere late 30s. Perimenopause can go on for several years before you're classed as full menopause, which can also go on for a very long time. There isn't a definite answer.
Yeah, anytime... Basically, from your late 30s, you can start perimenopause. And it can, with some women, start earlier, unfortunately. And some women, it doesn't start till later of perimenopause. When they say that you're in menopause is when you have been medically, now it is said, at the moment, they may change it again, that you've not had a period for 12 months. So if you've not had a period for 12 months, then you're deemed to have gone through the menopause and you're now into post-menopause. That doesn't mean that your symptoms stop, unfortunately, because some women, they still have their symptoms.
That's very difficult for women that have had a hysterectomy, because obviously you don't get that period marker, although conditions like fibroids, probably the most common one that I see, do tend to get worse during perimenopause and that sort of period of the unstable monthlies.
Somebody's asking what helps with hot flushes.
I was going to say ice, but that's just such a stupid answer. Fans. I'm just thinking everything that I've had today. Ice cream, fans, HRT and natural remedies. I mean, I'm going to leave all the natural stuff to Phyllis because what she doesn't know isn't worth knowing.
Correct.
Myself, personally, I'm in the HRT camp because that was my personal choice and it suited me. And I'd already suffered for way many more years than I thought I needed to. I didn't want to suffer anymore. I wanted it fixed. So it's very much a personal choice. During perimenopause, a good over-the-counter menopause supplement. I started taking that before I was in full menopause. And that definitely helped when, you know, the symptoms were a bit milder. Phyllis, I'm going to hand over to you for natural.
Yeah, thanks, Kelly. So, really simple stuff that you can try and do is, it sounds great, but try and wear as many natural fibres as you can. So avoid wearing anything that's, you know, like acrylics and things like that. So trying to keep natural fibres closer to your skin that are breathable. And that's the same as your bedding, trying to have more natural fibres. Looking at your diet and trying to avoid, sorry for those who is alcohol. That's often one of the big triggers. Extra spicy food, especially if you don't normally have spicy foods. Caffeine, again, is another one of those triggers that can trigger hot flushes. So it's really trying to look at those things. The other things
play a big part in this as well.
Yes, big time diet can. I'm not a nutritionist, so I hold my hands up big time to that. However, what I'd say is that you're trying to avoid, and I always say this anyway, generally as an osteopath, I'm often saying to my patients, when you look at your diet, think about those, going back to the rainbow, as boring as it sounds, but having a variety, having the brassicas in there, having things like, you know, the spinach, the broccoli, having some colourful food. Yes, some of the triggers can be things like tomatoes and stuff that might cause some reaction to it, but things like, as I said, the other green vegetables, those all help. And you do need to have some protein, but making sure that they're, you know, maybe sort of like the chickens or going for salmon or something like that, or having a vegetarian diet, so having legumes and things like that. Those can all help.
You was talking last week, Phyllis, about some oils and stuff. I don't know if oils would necessarily help with flushes or anything that people could drink that would help reduce.
So as far as essential oils go, what you want are the ones that are going to, I often call them like the women's oils. So things like ylang ylang, I wouldn't suggest. I know there is a particular brand that talks about ingesting essential oils. That is not something that I agree with. I've been an aromatherapist for it's coming up for 30 years. So I've used essential oils for a very long time. I would not ingest them. So I don't suggest that. But oils that help are things like ylang ylang. They help your stress, soothe anxiety, which is sometimes that can cause you to get some of these stresses when sweats when you're stressed. But it's a really good balancing hormone. Sweet orange oil, that's another one. That's fairly easy to buy. I would make sure if you are going to get essential oils that you get them from reputable places. So getting them off the internet on certain sites, if you can't guarantee where it's coming from, you want it as pure as you can get. and there are a couple of places that you can get that. I know definitely they're online that you can get those from. So I don't know whether or not I've worked out how to connect with me yet, Remy. So I'm relying on you to do that at some point. But yeah, I can let people know about those places that exist. But yeah, I'd say ylang ylang, neroli, carrot seed oil is another one. That's a really good one to regulate hormones. And sweet orange oil. Those are the ones off the top of my head.
Okay, got Mrs. Doubtfire coming up. She's got some suggestions as well. I've sent you an invite, Mrs. D, if you want to pop into the box, or just request the box. Guys, if any of you want to come up and ask your questions, you are all more than welcome to request. Because sometimes we might miss a question or we might see a question, but somebody's still talking, so we don't get to answer you. So you are invited to come up and ask any questions. Hey, Mrs. D.
Hello, Poppet. I've got my fans on. Can you hear me all right?
Yes.
Brilliant. I've got 2 fans on me at the moment, and I'm sure a lot of you can absolutely bloody relate to that.
I've just turned mine on.
Jesus, it's fucking hot. Bloody hell, every crevice. Anyway, I've got a couple of tips that I have struggled with perimenopausal symptoms for probably 2 years now. And the thing that I struggle with the most is hot flushes. So I've got a couple of products. So get ready to take screenshots, my loves. Right, let me figure out how to do this again. I haven't done this for a while.
I'm going to put you on big box as well. Hold on.
All right, my love. There we go. Here we go. Go to enhance, I think.
That's it.
Nope.
Enhance, and then the green screen. I know Mrs. D's back. We're all so happy you're back, Mrs. D. We love you.
Oh, bless you. Right, did that work?
Yes.
Okay, so this is one of the first products that I use, and I buy them all of the time. They are absolutely incredible. Basically, they're normally used for headaches, and when I pop them on, they help reduce sort of my general temperature, but especially so in my face, because it's literally on your head. You could choose to slap one on your ass if you wanted to, but I'd need quite a few packs. But I pop it on my forehead because I don't know about anybody else, but I can tend to be quite headachy when I've got a hot flush. Right, for a head cold, exactly, love. So these are absolutely perfect for hot flushes. Let me get you the next tip, my loves.
All right.
The next one.
You better stay in here, mister. Sorry.
The next one, darling, that's all right, my love. The next one, darling, is these head fans. They're cheap as chips from Amazon. They're normally between 8 to 10 quid. You hang them around your neck. They're really light. They break after about 6 months. You can sometimes get a replacement from Amazon, but they are incredible.
I've never seen these before.
You can angle them. They are incredible. You can angle them so that they're on your cheeks, so that they're in front of your cheeks by your nose, the side of your cheeks by your cheekbones. They're incredible.
Everybody.
So yeah, take a screenshot, my loves, and you can probably find them cheaper on Temu, AliExpress, stuff like that. Because I'm telling you now, you're not going to get a long-lasting product. It's cheap and cheerful, and they're absolutely incredible. So now I'm saving the best for last. These are absolutely amazing.
Drum roll, everybody. Oh, I'll have to put some in my TikTok shop. Go on.
The final
I love
product.
the Ordinary stuff.
Oh, the Ordinary is fantastic.
Now,
I love it.
If I could give you the briefest description of the Ordinary, they use minimal products and focus on ingredients and formulas, which is why they're really reasonably priced. They're really good quality. They've got incredible reviews. And this is one of their newest serums. And it's their barrier protecting serum for those that can sometimes get red skin through flushing or rosacea. So whenever I do my skin, I have like a 30-step skincare. I absolutely love Korean skincare. So I have so many steps to my skincare. And by the end of it, I look absolutely beet red and I've got a hot flush. This takes the redness away in probably 20 to 30 minutes, reduces the heat Whereas before I would have pain in my cheeks. The hot flush would be that painful. So this stuff is absolutely incredible. So that's the product. I'll bring up the description now, loves.
Oh my God, Mrs.
I
D.
swear by the Ordinary as well. It's amazing.
It is absolutely an amazing product.
Yeah.
I'll read this to you, darlings. It says, trending as the pink serum. The Ordinary's Soothing and Barrier Support Serum is a multi-active solution developed for sensitive skin and those prone to redness, providing an immediate 86% boost in skin hydration. The serum is enriched with sugar-based humectants to lock in moisture and nourish the skin barrier. Vitamin B12 gives the serum its signature pink hue while maintaining the skin's natural moisture levels. Bisobobble and gallic acid derivatives combine to visibly soothe the skin and reduce the appearance of redness. The serum should be implemented into your prep, treat and seal regime as step treat. It is recommended to apply after other similar water-based serums, but before oils and creams. To break that down into really, really simple talk, you use your serums in order of thickness with the thinnest first.
Right.
So if you only wanted to use this serum, you would wash, tone this serum, then a moisturizer. Or if you use other serums, you would use those serums before this one, because it's quite a thick one. It almost looks like, you know, the pink stuff you would put on your body when you had chicken pox.
Yeah.
It's kind of a little bit like that. It's a fabulous colour. And I promise you it will, calamine lotion. It will reduce redness in 20 to 30 minutes, whereas before it would take 3 to 4 hours for me.
That's amazing.
So trial it. You can always send it back. But I just wanted to come up. I've trial and errored so many products and so much stuff because I would get such painful purple hot flushes in my cheeks. And now it's just incredible. It's so much better.
Could you do me a favour, Mrs. D? Could you just run through all three of them again, just very quickly?
Yeah, of course I can, my love.
Thank you so much.
Okay, so this was the first one, Poppets. Oh, thank you so much for the gifts, my loves. Thank you, darlings. I was in the green screen, I didn't see. Thank you, loves. This is the Cool and Soothe patches, which are great for headaches. They're great for your kids if they've got temperature. You pop them on your forehead. You could have one on each cheek if you wanted to. You could pop one on your chest. I don't know if anybody else gets a hot chest when they've got a hot flush as well. You can literally, you can hold your hand a centimetre in front of your face and you can feel the heat.
Yeah.
That's how bad the hot flushes can be. So that's the Cool and Soothes, my loves. They're incredible. They are so cheap. And if you want to get them even cheaper, buy them from Home Bargains. They're even cheaper than Amazon. On Amazon, they're a couple of quid. You can get them even cheaper on Home Bargains. The next product, my loves, this is the head fans. They normally come in blue, black and pink. They're cheap and cheerful. They'll last you about six months. Buy them in bulk from Temu, AliExpress, stuff like that. They're absolutely fantastic. You can twist the fan heads to your cheekbones, to the front of your cheeks. And honestly, it is bliss when you've got a hot flush. They're just incredible. And they're not too loud. You can wear them out and about. And, you know, they're pretty subtle around your neck. They're not heavy. So that is the second product, my loves.
Lovely.
And then the third and final product is a skincare product, which really helps those with hot flushes and or rosacea. So it's really good for your skin barrier. And it's the final serum you would use before your moisturizer.
Oh, amazing. Thank you
Mrs.
so much.
Can I just add something about the Ordinary?
Go on.
Yeah, of course, my love.
With the Ordinary, if anyone has never used them before and you email them and you tell them all your skin issues, your age, your skin type, your blah, 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 they will email you back what it is exactly you need.
Oh, that's incredible. I didn't know that.
And then I've used them for years now. They're my go-to. And in what order to use them, because you said an important thing there about the water base, because sometimes people put niacinamide on their face and then they put something else on and it actually burns. So,
yes, absolutely. You can get reactions and everything.
So they give you exactly what you need and in the order to apply them.
Oh, that's brilliant. I mean, people
It's free.
can have preferences and things like that, and also make sure whoever you're buying with, you can buy through Cult Beauty, you can buy through Look Fantastic, which are like official partners, and they've got really good return policies, because you may not get on with the serum, and what you should do is test patch it sort of at the back of your face, I would say below your cheekbone, where the skin is a little bit tougher and it's not so sensitive, just to see if you have any sort of reaction to it. But it's Beauty Bay as well. Yes, Carrie Love. But it's super, super
And ASOS,
soothing.
that's what I use.
And honestly, I love using it. I feel like an influencer when I'm putting it on my face. I feel fucking fabulous. So I really recommend that product. And obviously I'm not, affiliated and all that bollocks. But yeah, I'm a bit nervous because I haven't been in the box for ages, but I just wanted to help any women out there that's struggling with hot flushes. I got you, girls.
Thank you so much. Thank you, darling.
I will pop down in the comments. Loads of love, guys.
Thank you, Mrs. D.
Thank you
Love
so
you.
much for the
Thank
gift,
you.
Poppets. Bye, guys.
Bye.
Bye,
Bye, my
darling.
loves.
Remy, can I just add? So I hadn't realised I can actually mention the name, so I am going to mention the name. So
Go for it.
the essential oils, where I was saying you're either going to get them from Neil's Yard, which most of you know. Their essential oils are really good, and you know where they come from. They know where they come from. Or otherwise, the other company is called GW Baldwin's. They're actually based in London, but they do have an online shop, so it's GW Baldwin's. And their essential oils are really, really reasonable, and again, you know where they come from. I've used both Neil's Yard and essential oils for the last 30 years, and GW Baldwin, so I've used them. The other tip would be get yourself a facial mist. You can either make it yourself, and that's literally just getting yourself a little squirty bottle that you put water in. You can add some essential oils to that, some of the ones that I've mentioned. But even if you don't add essential oils to it, just having the water, just a small one, that you put in the freezer so that it freezes. And then you take that out with you so that when you need it, it starts to melt anyway, but it stays cold, and you can just mist your face with that. That really can help. Or you can even, if you're, you've got all your makeup done. I don't wear makeup, so it's not normally a problem, but you can do it at the back of your neck, which often will also help to cool things down. And that's the same as using the good old fashioned face cloth. Wet that, put that in the freezer, get it cold, put that on the back of your neck, especially at night, or on your wrists.
Oh, brilliant. Thank you so much. These are going to be so helpful. These are really, really good ideas. Thank you very much, my darling. Foofy McFoofs.
Good evening.
Hello, what did you want to add to the conversation, my darling?
I really wanted to talk about the mental health side of it, but before I do, I'll just mention another
tip.
The flushies, another tip, that's the word, thank you. You know those like blue gel mat things you get for cats and dogs?
Yeah.
To sit on? I've got one in my pillowcase.
Ooh.
Game changer. Because as you lay back on it, you can feel the wetness of it, and then automatically it cools down the back of your neck.
Yeah.
That's a nice idea.
So it worked for me. I was perimenopausal, very early 30s. It seems to have been something that's all the females in my family, and unfortunately ovarian cancer had been as well.
Yeah.
So we've always been privy to quite young smear tests, things like that. So around the physical side of things, I always kind of knew what to expect because my mum always spoke about it. My sisters always spoke about it. But the thing that actually knocked me off my feet, and I just want to give a trigger warning, I don't want it to upset anyone, but I ended up being sectioned because I made a very serious attempt on my life.
Oh.
And that was about 6 years into it. And that's the thing. I know mental health needs to be discussed anyway, and it's not enough. But it is the thing that really knocked me off my feet during this whole menopause journey, if you like. It wasn't very nice. So when I was perimenopausal, I didn't really have any symptoms as such. My monthly stopped, went into the next stage. I was full on menopausal, and I was okay. And then I hit my 50th birthday, and it was like everything that you'd expected 10 years before came along and punched me in the face.
Oh, dear.
And then it was then that realisation and looking back and going to, I've had lots of therapy and lots of support, amazing support, that we kind of factored in that's where my complete breakdown was in the middle of the whole madness of it all. Because I lost myself as well, you know, that I had no idea who I was. I had no idea what clothes I wore. I didn't know, I just didn't know who I was anymore. I lost my identity. And that in itself is quite scary, isn't it?
I hear that a lot. One of my friends entering perimenopause, I remember having another late night call with her as it was at the worst for her. And that was one of the things that she said, is that like I don't like even recognize who I am. I don't know who I am. It's so confusing and heartbreaking.
Yeah. I struggle with my mental health anyway, and that I acknowledge. I have complex PTSD. There's other things that go on, but this, it just seemed to exacerbate it, I suppose. It was like boom.
Yeah.
I did have postnatal depression, and an awful lot of that kind of felt the same as well. So then you're looking at the hormonal side of things, aren't you? Hysterectomy lady, Kelly, said about HRT, and I tried 3 different lots. Eventually we got to one, Femiston, I think I'm on now.
Yeah, it can take...
Yeah,
you know, there isn't a one size fits all, and it's never a quick fix. And you're absolutely right. I mean, it can cause that severe symptoms that it leads you to the situation that you were in. It can never be underestimated.
I urge anyone who's got any concerns about you're feeling depressed, you're feeling low, your anxiety. A lot of people will say, oh, I've never suffered that before, and oh, I'm just this, I'm just that. Don't take it for granted. Don't leave it, because you don't want to end up in a situation. It's never too late.
It can be hard to put into words, can't it, when you're trying to describe how you feel, especially if it doesn't neatly fit into one category. And I said last week, so sorry to anybody that was listening last week, it was when I realised that I just wasn't feeling anything anymore.
Yeah,
I wasn't excited about anything. I wasn't exuberant. I wasn't all the things that made me.
Yeah. That's where I got to. So what's the point anymore?
Yeah.
I had no idea. I self-medicated for a few years on alcohol, and I'm quite disgusted looking back that those closest to me never said anything. I really wish they had, because I must have stank. I was drinking about 3 bottles a night.
Maybe they cared and they didn't know how to help.
Maybe.
And if that was helping you at the time.
Yeah, absolutely. Tony has just popped up. Well, no, I'm very honest in how I speak, and I'd rather someone said the wrong thing to me but said something so we can start a conversation. But I do appreciate not everyone's the same as that. I do know that. But yeah, just talk to people. And if you've got someone you trust, whether it's a girlfriend, a boyfriend, or whatever, share with them. I journal everything now, everything. And my journal of menopause is going to any of my younger girlfriends that haven't reached that stage yet. It's yours for the taking, because things like
get it published.
Tinnitus. I had tinnitus as well, and that just to me was bizarre.
Yeah, I mean, there's so many. We spoke about these last week. It's so many different symptoms, and most of it is related to, as I said, the decrease in collagen and how it works with the estrogen and all of those, which is what affects the small bones in the ears, hence the tinnitus, the dry mouth, all of those things, and certainly the mood swings and stuff. I always say to women, it is a case of, you know, community is everything. And by community, I don't necessarily mean, you know, the wider community, but it's like, it is your friends or finding people that you can talk to, because it is very different for every women, and some might have really severe, you know, symptoms in terms of their mood swings, feeling depressed. I can't tell you how many patients that I've had who's, you know, have got to that stage where they're thinking of coming out of their marriage or their partnership and stuff like that. And you know, there's no reason for it other than the fact that suddenly everything's changed. And it is because of their hormonal changes. And some of those have actually got divorced or left their partners. And then after a few years, when they're coming through the other side of it, have realised, actually, I didn't want to do that. But, you know, a bit like as Kelly said there, that, you know, you don't feel anything. That's what sometimes happens. So it's really hard.
It's like on the libido as well, isn't it? For us, for me and my partner, that was a big impact of it. He just assumed I'd gone off him.
Yeah.
And but it was because I'd gone off life. I'd gone off everything. There was nothing going on.
And I think
he's very supportive, but he didn't understand it. But one of the things that really worked for us was me writing things down for him.
Yeah.
In words that he could understand.
Yeah. And I think that's the thing. It's having conversations.
And men should be in here, shouldn't they?
Yeah. Oh, definitely. This is something that affects everybody. And the more that we can talk about it and recognise those differences, and you know, and exactly as you're saying, you know, that change in your personality. I remember exactly the same thing happened to me, and I was studying at the time, and you know, part of me was saying, oh, it's because I'm really stressed trying to do this dissertation and whatever, and it wasn't that, because I'd done loads of stuff for it, but it was all because of what had been going on with those symptoms, and I knew a lot about it but still didn't realize that that's what it was associated with. So I think the more we talk about it, the better it gets, that women realize and that men realize, and you know, anybody realizes that.
And that was my thing that took me by surprise, was the mental health side of it. It's because I am very fortunate, you know, I'm one of 4 girls. We talk. My mum is my hero. We've always had a very open and honest family. We spoke about everything. So that just was like, boom. And I think for my sisters as well, it was. And then fortunately for them, because that did happen with me, and that it happened to both of them as well. One of my sisters, the middle one, didn't get out of bed for 6 weeks. Now, if you've ever met a stuff and nonsense person, that's my sister Jo. She'd have to have a leg hanging off before she wouldn't go to work. You know, she's that girl. So it just took it out of her. And then my youngest sister was just vile. She was vile for about 3 years. Yeah. And it just wasn't her. It wasn't her. So for me, it was that part. So, yeah, I just wanted to say, everyone talk to each other.
Thank you for raising the mental health side of things, because it is important that is mentioned, because it is a big part of all of this. Oh, you're so welcome, Kate. You're so welcome. I know Phyllis and Kelly have to get off soon, so I just want to check in with them how much time they've got left.
I'm okay for another 20 minutes or so, and I definitely did want for Mrs. Doubtfire and all the others that have mentioned it, to come back to the dryness. So as long as we can... Yeah.
I'm going to jump down anyway, ladies. Thank you.
Come back.
Thank you, no hurry. Darling. Thank you so much.
Thank you.
Love you.
Thanks for the gifts, everyone. And I've got another tip. Get a couple of scrunchies and just tie your boobs up. You'll thank me later, all right? Bye.
Oh, I wish I had boobs like that.
I don't think you could get scrunchies big enough to tie mine. That's for sure.
Just quickly, guys, there are some help and support numbers up in the poll. So if anybody does feel like after this live they might need any additional support or need to talk to somebody, please do check the poll for support numbers as well. Phyllis, how long have you got left, sweetheart?
I've got about another 10, 15 minutes.
All right, brilliant. Thank you both again for being here. So can everyone in the room please make sure you follow Phyllis Coach and Hysterectomy Support. These are both my friends on and off the app, and they're also both my clients who I've helped produce digital products for their areas of their business that they do. And if anyone wants to access Phyllis's stuff, the hysterectomy stuff and the natural hysterectomy stuff, here I go again, menopause stuff, sorry, managing the menopause naturally, please send me a message, because I haven't helped her set up her TikTok yet, and I will get you Phyllis's link to her website if you want to get the Phyllis, you tell them what it is, because I'm my words are not coming out right now.
So I've got 2 things. It's perimenopause and menopause the holistic way. So it's a full-on self-led course, but it's got exercises that you can do, movement. And when I say exercises, I mean they're just like simple movements that you can do that help with bone health. Stuff on the essential oils, so some do's and don'ts and some information about essential oils, telling you how to make suppositories, your own suppositories for foo-foo dryness, and a little bit on nutrition side, so it's like a couple of recipes, but also telling you about the menopause and the perimenopause and some of the symptoms and why they happen, and it just sort of like goes through. So I think it's about 5 or 6 modules that you can do in your own space. Once you've got it, it's your time to do, but they're quite detailed. And then there's one that's a little bit less detailed than that, that is almost like I think, I can't remember what it's called, but it's something like perimenopause and menopause. It's more than just hot flushes. So it's going through those things.
So message me if you want that and I will send you the link. And also Kelly, who's hysterectomy support, she has got links in her bio. Is that correct, Kelly? And also she does do some lives.
That is correct. Yep. And I'm more hysterectomy and pelvic health support, but it's all on my website, and anyone can drop into my message box. It's definitely open. I checked last week. Our email address is on there as well. And if anybody is really, really struggling, particularly in light of the conversations we've had tonight, always reach out. There's, even if it's just a case of somebody being there.
Alexa,
don't ever not do that.
Thank you, ladies. And please, can we all keep tapping the screen whilst we're here? And we are going to move now to Lindsay and then to Mum of Max. Lindsay, hello, good evening.
Hi, everyone.
Hello, sorry to keep you waiting.
Oh, it's fine. Don't worry. I was late as well. I was furious because I knew this was coming on, and I was late. I got held up at work, so I just wanted to touch on the mental health side of it after Fufi mentioned it. So obviously last week we spoke about the hysterectomy side. So I was like sort of pushed into my hysterectomy as a shock. Although I'm not too young, I'm 44. But it wasn't a planned hysterectomy, and it was sort of like a big shock. And I'm wondering about the people who have suffered from mental health for a while. So I suffered from mental health before having the hysterectomy, and I sort of managed to handle that. And externally, like my friends, even close family, wouldn't have realised what I was going through. Like as mental health, I feel like I hid it very well. And like dealt with it really well. So I feel like I had nailed that for like years and years. And then now, after having the hysterectomy, I feel like the mental health side, but it's a different kind of thing. So I'm just wondering if any of the other ladies feel the same. It's a different kind of mental health thing. So I feel like it's harder to mask.
Do you mean when you're in perimenopause, it's different type of mental health that you're dealing with to before menopause? Is that the question?
So now I'm in menopause. I feel like from before, when I was younger, even before perimenopause, when I suffered with mental health, I feel like it's a different kind of like effect, and it's a lot harder to mask and deal with.
Okay.
Do you get what I mean? So now I'm having times where people are like, whoa, are you okay? Even at work, so I have to remain like really professional at work, and I used to always hide it very well.
Phyllis, Kelly, do you want to come in on this and with your thoughts on this?
Well, on the masking side, I have ADHD as well. So I spent many years being an absolute master at masking in the professional workspace. I don't do that so much now, and I don't know whether it is all linked to menopause and just the fact that I am calmer. So my other half says that since I had my hysterectomy, he feels like I'm like a dog that got neutered and just calmed down. I don't think I have actually calmed. I mean, that's just the way they put it, isn't it? But I understand what he's saying about the calmed down bit. I still have my moments. So yeah, I think it is different. And I think sometimes that's the thing that bothers us the most, is not that it's worse or better or anything, that something's different and we can't put our finger on it. And we always want an answer, don't we? We always want to know why, because then we might be able to do something about it. So I think we drive ourselves round in circles sometimes, trying to pinpoint and explain and put into words for ourselves and to explain to others, and that gets very frustrating.
Yeah, definitely. I mean, now, like, I literally, sometimes I feel like a raven. like I can't control, like, all the emotions, where normally I can do that.
Yeah.
And, like, say, my sister, who's, like, she can speak to us honestly, and she's like, whoa, what is going on? Like, it's not you, like, not, like, you. So, I don't know whether it's a case of it's mental health and I need to manage it that side, or if it is a case of the hormones and it's the hormonal side.
Yeah.
You get what I mean? Like, it's
Phyllis, would you like to come in?
Yeah, I was going to say, I mean, I think the reality of it is that every woman is going to be different. There is no one size fits all, either in whether or not HRT is going to work for you and whether or not it's the right amount of HRT. It's playing with it, seeing what's worked, whether or not natural remedies are going to work for you. That all of that is going to be individual, the same as how your mental health is affected. I hate the fact that we separate health and mental health as if they're two separate things. They are the same thing, but you know, that's the way of the world, and that's how we've got to get through it.
Yes.
The reality is, somebody might break a bone in their foot, and somebody else breaks exactly the same bone, but it doesn't feel the same to them. And it's the same with mental health.
Yeah.
So what you had previously, as in what you were struggling with, was what you were struggling with at that time. Now, the fact that because your hormones have changed, and that's affected how we balance our things. So yes, it might have more of an effect, and that your mood swings might be really more obvious, but it isn't just necessarily that because it is the menopause, it's different to what it was when it was previously. It can trigger the same thing. So you might well go, you know, you might have had PTSD that you've managed to control through medication or through having counselling, coaching, whatever it is. But then you start to go through the menopause, and now it starts again, and you start going through similar symptoms or worse than you had previously. It's a case of we have to deal with whatever's going on at that point. So it is a case of seeking as much help as you can get, speaking to people, trying not to. And I understand totally what Kelly's saying about masking, because, you know, I'm not diagnosed, but I know probably because there's a whole load of things that I've got that show that I've got various new neurodivergent traits. But we do learn to mask things as we, you know, and especially as women do, because we end up having to deal with so many other stuff that's going on that we put ourselves and we push ourselves further and further down, which means that we mask those, you know, our feelings and how we deal with things. And all I can say is, when we start to recognize that we're doing that stuff, and sometimes we don't, and it might be family members, like you saying, your sister is honest and says things, then we got to try and do as much as we can to try and deal with it in whatever way we can, whether or not that is go through the talking therapies, whether or not that is getting medication, whether or not it's using natural remedies. The big thing that I would say that has a great effect is sleep. And we forget how much, and again, that's one of the things why I was saying at the very beginning about trying to, you know, use natural fibers and stuff so that we can sleep better. If we're not sleeping, everything can go to pot.
Yeah, absolutely.
Yeah, so that's been a problem for a while. Like I literally never sleep. I'm like an hour. I sleep about 10 minutes before the alarm goes off. But it's frustrating because the job that I do, I sort of help people and champion people for mental health and different things. So now I'm like, I don't know, I can't explain.
Yeah.
Like before, I was nailing it and I was fine, but now it's just a different kind of feeling. It's hard to explain.
Yeah.
So I think it must be hormonal.
It probably is. Look.
Yeah, because I mean, lifestyle-wise and things that are going on externally aren't anywhere near as bad as what they were before. Yeah. So like, I'm more fortunate now and like happier and things like that. So there's nothing like negative in the lifestyle type of thing. So I'm guessing it must be the hormonal type.
Yeah, so I mean, in that case, it is kind of, you know, additionally trying to use those other things. So whether or not it's the HRT or whether or not it's using natural remedies, either herbal remedies or using essential oils to burn or to, you know, brighten your to using the baths and things like that, which will help with your mood and start to bring things up to as natural a hormone boost as can be. You know, it's the foods as well. It's like having, you know, yams and stuff like that are more similar to the hormones that we had. And it's, you know, again, you've got the bioidentical hormones, which are not quite the same as the chemical hormones. So it's finding what might work for you, and it really is trying to find, you know, trying different things, because it might not necessarily work straight away.
Yeah, thank you,
definitely.
Phyllis.
Thanks, Phyllis. I mean, I did take note of the, you know, the herbal things that you mentioned last week. I think it was it Flaps that messaged me after I had spoke last week and told us what you were that you.
Yeah,
and to be totally honest, I forgot all about it, so that's another problem.
Yeah,
so
yeah.
When we're talking about it now, I remember, and then by next week I'll forget.
Yeah.
So
Hey,
I think
Lindsay,
I'd rather do the natural.
Lindsay, sorry, darling. I think the ladies have given you a lot of sort of suggestions. Mum of Mac has been waiting a really long time. I'd really love to get to her before these two ladies have to leave.
Yeah, of course. Can you drop me, Remy? Because I'm not sure how to do it.
But thank you for coming up, Lindsay. And
thanks a lot.
I think Mrs. Doubtfire wants you to see that, but I just wanted to get to Mum of Mac. Thank you for coming up.
Bye, Don.
Hey, Mum of Mac.
Hey, you're right.
Hello. Sorry to keep you waiting for so long.
No, honestly, it's fine. It's fine.
I felt bad because you were just there, and it was like,
No, don't. It's fine. I'm taking in a lot, actually, so it's fine.
Good. What would you like to ask or contribute to the conversation?
So if I'll give you a tiny little background story first. I suffer with endometriosis. I've been given the Prostap injections, which have obviously, they've said it will cause you to go like a temporary menopause thing. So my ovaries have shut down at the moment until I've got my consultancy appointment this Thursday, where they will speak about the possibilities of maybe having a hysterectomy, etc., etc. So I've got a lot to take in and a lot to kind of talk about in regard at my consultation. The night sweats have been an absolute killer. I'm not going to lie, that they've been the worst thing I've ever experienced. I've been on Tibolone, but I don't think it's actually working. I don't feel like it's doing anything. But then I've only been on it 6 months. Do I give it a bit more time? Do I kind of speak to them and say I genuinely don't feel like it's helping the sweats? I'm just in such a weird space right now with it all, because I've got so much to think about and so much to, I don't know.
Ladies, any advice or any tips that you could share with Mum of Mac?
Did you want to go first, Phyllis? Just, I'm aware I talked over you last time.
No, don't worry at all. Yeah, Mum and Mac. So it's really difficult. I don't give medical advice as such. And endometriosis, one of the big ones. I know how awful it is if you've got to go through, especially in early menopause, when they start giving you the drugs to combat it. It might well be, I would have a discussion with them about whether or not you feel that it's working, so that they can make an adjustment, because it's exactly as both Kelly and I said beforehand, everything is always going to be a suck it and see, for want of a better expression, because it's going to be different for everybody. But in order to help with some of it would be all of those natural things that I've said beforehand. So trying to make sure that it's as natural fibres as you can. Cotton's the best one. Getting yourself a decent fan, trying to have the mists, as I said, that you can either make yourself or that you can buy aerosol ones, just make them so that they're cold, and using those. Those are all of the additional things that you can do. And also, as I said, looking at your diet, trying to cut back on alcohol, caffeine, any of that, and remembering that caffeine's in tea as well, because many a times I've had people say to me, well, I don't drink coffee, but I have about 20 cups of tea a day. And it's like, well, you're going to have caffeine then.
Yeah, so, I'm a sucker for caffeine, so maybe that would be an idea to start kind of looking at.
It really is one of those things that can trigger it. So, it's worth trying to cut back on that and see how it is. I always say to people, aim for 80-20, and with a bit of luck, you'll get a 60-20 change. So,
Tibolone, it's got another brand name, and I'm sure it's Lev something. I can't remember it. Tibolone. There are some
I think it
studies
might
on
be.
it.
Is it Livial? Livial?
Yes,
Is it? Yeah.
that's it. There are some studies that show it's not quite as effective as a combined HRT.
Right.
After 6 months, I would expect you to be either feeling better or not. You should have a good grip on whether it's working. How long have you been on the Prostap injections?
7 months.
7 months. Okay.
So I got my consultation on Thursday because they only like to give 6, and then you have to have a consultation.
That's right.
Because obviously the waiting times and stuff like that, they had to give me an interim.
Yeah. I had the Zoladex, you know, the one they put in your tummy.
Yep.
So endometriosis, it's such a tricky whole body condition. A hysterectomy will help with some of your symptoms, like the heavy. Are we allowed to say, you know?
Yeah. I get you.
We're allowed to say that. And the unpredictability. My hysterectomy gave me about 18 months relief from my endo symptoms, but endo is always outside of the uterus. It is never inside.
Right.
So it's not actually a uterine condition as such. So just be aware of that. Lots and lots of my women in my group get a massive amount more relief than what I got, and obviously some don't, and that's your reason. The gold standard treatment for endometriosis is excision surgery, which a lot of our consultants aren't qualified in. It can be quite hard. I had to get mine done privately. But endo advice, definitely happy to talk to you about that. Feel free to jump in my inbox if you need help with questions to ask. I can have that to you in a jiffy. And also it's a Facebook group, and I believe they've got a website called Nancy's Nook.
Right.
And it is the single best endometriosis resource out there that I have ever found in, well, at least 10 years.
Right.
I'm going to drop it into, I'm going to drop it into the comments, actually, because you have to be so careful to get the right information and the right advice.
It's just, it's a lot to take in. I mean, I'm 34 years of age, so all right, I'm not like young, but I'm not like older either. And it's just a lot. I mean, I've got 2 young children, so I have to kind of consider every alternative, really.
Yeah. The Marina coil worked well for me. It doesn't for a lot, but it worked well for me.
Bled constantly on that. Every form of contraception I've ever had from the age of 14, because I started it due to my heavy menstrual
monthlies.
Yeah, it was just everything I've been on. I have bled for months and months and months straight on, so I've had no relief from anything I've been
of it.
No.
Yeah, it's a nuisance. It really is a nuisance, this one. Do you have anything? Do you know whether they suspect any adenomyosis or anything else going on?
I'm not sure. They went in with a laparoscopy after I said, look, I feel something isn't right. Like, I'm constantly in pain. This is hurting. Intercourse is hurting. This, that, and the other. Blah, 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 blah. Painful menstrual cycles. And they done a laparoscopy and they found endometriosis on my lining on my womb, the fallopian tubes or ovaries, and the wall of my uterus. So they found it in 4 places. They burnt it away. Everything was okay for about 6-7 months. I didn't feel anything. I felt like, oh my God, this is amazing. I've been cured. And then it come back tenfold. And so they said that they're not going to go back in.
Ablation is like cutting a tree down but not taking the roots.
Right.
Endo is really sneaky. It hides. It needs somebody that knows what they're doing to go in and take out everything it's infiltrating, so it can often not be seen on the surface, particularly if you've had an ablation or other treatments, because you'll naturally have scarring there anyhow. But endo and adeno tend to coexist for some reason. So again, often adeno is not diagnosed until pathology after a hysterectomy. It's another one of those really tricky things, but you don't need a diagnosis to validate if you're suffering and you make a decision based on that suffering. You know, I have women come to me in pieces because their pathology's shown nothing. So they've never found the reason, but the suffering is enough of a reason.
No, I appreciate, like, obviously everything you've just said. I mean, a lot of women don't get. I think we have to push really hard for it, and obviously, like I said, I know obviously once I have the hysterectomy, if that's what we all decide, if I decide to do with my consultant and stuff, that I am going to then hit full menopause. That it's undeniable. So
yeah.
So yeah, no, but thank you.
Sorry, can I just interrupt? Phyllis is about to go. If you've enjoyed Phyllis, could you please just drop some gifts on her very quickly before she has to go, just to say thank you for her time, because you know, both Kelly and Phyllis have given up their time for 2 weeks now. So if you wouldn't mind just showing a bit of love and just sending them some thank yous from all of us, that would be so appreciated. Even if it's just like a single gift. If you can't gift, don't worry, don't feel bad. But if you can, I would appreciate it so much, because they are giving up their time. Sorry to interrupt you all, but she just said she's about to go, so I just thought.
Thank you,
care,
Phyllis.
everyone.
Thank you so much.
Phyllis.
Speak soon, Phyllis.
I'll send you a
Bye.
message.
Yeah, take
Love
care.
you
Bye,
lots.
Kelly.
Bye
Bye,
bye.
Remy. Thanks.
Bye, darling. Big loves.
Bye.
Big loves.
I still want to go and live with Phyllis. I just feel like my life would be so much calmer.
I know.
And
Phyllis is the best. I keep trying to get her to come up here and visit me.
I mean, Fufi invited me into this tonight, so and she invited me last week.
Don't worry.
Who invited you in, Mama Max? Sorry.
Fufi.
Oh, lovely Fufi.
So yeah, but I just want to say, like, thank you very much. I've actually learned quite a lot just being in here. So I will drop and leave you lovely ladies. But honestly, thank you so much for all the advice.
Thank you for coming up and being.
Thank you.
No, thank you.
Pop over and connect with me if you need anything hysterectomy or endo.
Thank you.
I'm always around somewhere.
Thank you so much. Honestly, thank you. Thank you so much.
I'll give
welcome.
you a follow back as well, Mama Max.
Lovely. Oh, thank you.
All right, lots of love, darling.
Take care,
Lots
darling.
of
Bye,
love.
lovelies. Bye. Bye.
Right. Oh, it is helpful, isn't it? I think these lives are really important. And look, I know there's so many drama lives on, and I don't particularly enjoy the drama and try and avoid it. But also, if we can run these lives, I know they're not the hugest rooms, but if they are impacting and helping people, and people are learning something that will help them in any way, then doing these type of lives are really important for me. And I'm just so grateful that I also have people like Kelly and Phyllis who are knowledgeable in these areas, way more than me, that are happy to support me as well, to come and support and help all of you as well. So yeah, any love that you can give these ladies, I really appreciate it.
I love you as well.
You know I love you.
Oh, I love you.
And Mrs. D, what was that thing you were showing?
Right.
Because you brought another. Have you got to go, bub?
No, I still want to come back to Mrs. D.
Hello, Poppets. Hello, my loves.
Hello
When
again.
I came in earlier, I rushed a little bit because I was like, right, let me sort out what, we were kind of talking about hot flushes, but I missed a couple of topics. So I want to preface this with a warning that it's not going to be vulgar, but it's not going to be suitable for kids. So I'll just give, either pop them in the front of the iPad or some headphones or something, because we're going to be talking about our foo-foos, my loves. I think it's really important.
Mrs. D swears and says foo-foo.
I spend pretty much all day, every day talking about these. It's one of my introductions. My name's Kelly, and I talk about foo-foos, bowels, and pelvic floor
Fantastic.
and body organs.
It's a pleasure to meet you, my love.
You too.
I absolutely love it. So there were a couple more products I wanted to show you, my loves, that have absolutely changed my vaginal health, absolutely incredibly. As a teenager, I'm in my 40s, and as a teenager, the number one vaginal hygiene product was Femfresh. We've probably all seen it, that sort of peachy wash and all the rest of it. And that was fantastic for me. I used that for, well, decades, absolutely decades. But when I got into my later 30s, I noticed that not just the skin on my face changed, but the skin in your privates changes as well. And you find you can get more dryness to the point where if you scooched on the carpet, you could literally start a bushfire. So I started sort of messing around with other vaginal products that I could try. And I absolutely, let me grab it for you, my loves. I have used this for the longest time. Let me see if that brings it up. Oh, bollocks. Let me bring up the smaller one.
Where Mrs. Doubtfire, I think she's over on favorited, you know. The amount of swear bombs she's dropped today. I can't cope. We're not on favorited. We're over here.
Sorry, love. I'll try to be more careful. Sorry, darling. It's not really showing the product because I took a screenshot, but for some reason it's only showing it small. But basically, this is a product. It's a French product, and it's based with mineral water, and it's called Uriage, and it's called their Gin Fee feminine wash. It's absolutely incredible. It comes in 2 different sizes. This is the smaller tube. It is a very, very popular product. Vaginas all over the world love it. And so it's something that sells super, super quickly on Amazon. But you can also find it on Look Fantastic. And as soon as I started using this stuff, it sort of matched with my pH much better. It was much more gentle, very lightly fragranced, far more natural. And I found that I didn't have that dryness that would literally cause like itching because it would be so dry. And even at one point you can get cracks and all of that. It can get really, really, really uncomfortable. So this product, absolutely fantastic. And then what you can pair it with, they are absolutely self-cleaning. Don't go shoving this up your you want to clean on the outside, on your vulva, and on the inside of your lips. You don't go inside.
Never douche.
No, never douche. Because we
never
have
do that.
Naturally cleaning and cleansing vaginas. So yeah, that will sort itself out with water. So the next product that I want to show you that's really good for vaginal health, but its primary use is actually for my face. This is also by Uriage. Really, really cheap product. I think it's about £15 and it's about 400 ml. And when I want 24 to 48 hour hydration in my face, I will moisturize with this after I've applied all my serums. It is a really, really intense moisturizer. And then what I do, once you've moisturized your face, you've still got like moisturized hands, haven't you? So what I'll do is I'll cut my hands over my just so I'm not rubbing in cream, but I'm tapping her. So if ever you need a little bit of extra, sparkle up your hoo-ha, it's absolutely incredible. And it's so gentle that it doesn't cause any kind of irritation. And then the final Uriage product, I'm not affiliated at all, my love.
You bloody well should be at this point.
Yeah,
you should be, shouldn't I, darlings? I agree with you. This is now it was actually Fufi in the chat that reminded me of this, which is a facial mist. I have bought so many of these. This is a 300 ml can. It's about £10. And what you do between every layer of skincare, you use that facial mist and it locks in water, because a lot of face creams and serums these days contain hyaluronic acid. And if you don't put water on your face for the hyaluronic acid to draw in, it will draw moisture in from your skin. So if you're using hyaluronic acid without putting it on damp skin, you will actually make your skin more dry. So you will literally switch around your skincare if you start layering this into your skin. And then what's fantastic is when you're wearing your headfans, which I was talking to you about earlier, and you pop some of the face mist on, as the fan is cooling the water and evaporating off your skin, it's cooling you down. And this is 300 mils. It's French eau thermale. It's incredible. Read the reviews. Absolutely amazing stuff, my darlings. I don't have links or anything like that. This is just products that I've bought in my 40s, like so many times. And then there was one more thing. I read a lady in the chat that said that, I can't remember your name, I'm sorry, my love, that said that you're always having energy drinks and coffee. And I was exactly the same, more so for energy drinks. But I now have one of these every morning and they're incredible. And it's an electrolyte and it's by 0.5 and it's zero sugar, 0 calories. You add it to 250 ml to 350 ml of water. They've got several flavors and they're a couple of quid. Strawberry and kiwi is my favorite because I like it with a little bit of a tang to it. And honestly, I can literally feel myself getting more energy in the morning, but then you don't get the lull after it because of a sugar crash.
Yeah.
So you don't get that caffeine dip or anything like that. Yeah. I have gotten so many people onto this product. It's so reasonably priced. Thank you for the gift, Poppers. Thank you, my loves.
People are saying we're going to get this. I'm going to get this.
It's incredible. What I'm going to do, because I've put so many products and it hasn't really shown them very well, I'm going to make a video and I will tag you, Remy, and I will tag you ladies from today, if that's all right.
Yes, I'll share it. That's
and
amazing.
I'll put those products in. And, Remy knows me. I've never been one for trying to make money. I'm not affiliated. No links. Nothing like that. You will be able to see in all my screenshots how many times I've purchased these. Like, for example, this I've purchased 21 times.
Oh my goodness.
And it's all really reasonable products, reasonably priced products as well. And they're fantastic. I live with chronic pain. I have endometriosis and polycystic ovarian syndrome. And I also have menorrhagia, which is excessive bleeding. For example, I've been on a 5-month period at the moment. So I have to go for regular iron infusions. So I know what it's like to be in pain, to be exhausted, to be dry, to feel like a bloody prune. And these are the products that help me day to day.
Well, this is
so
you're amazing, Mrs.
Hopefully they'll help you girls in some way, and I will make a video, my darlings, in the next couple of days because I know it's a lot to take in. And sorry
they've
for
been screenshotting. They've got a whole shopping list now.
I know, bless them, and they didn't. I don't know why, but they didn't show up in the correct sort of ratio, even though it was a full screenshot. I don't know why. I think that's a TikTok thing. So I'll put together a video. I'm sorry for talking fast and stuff like that. I'm a bit, rusty with all this stuff. But thank you for letting me up, and thank you so much, everybody, for all the advice and relatability today.
It's been so helpful. Thank you so much.
No, thank you.
Thank you, guys. You're welcome. You're such... Hello, Patty, darling. You're such an amazing pioneer for important conversations, Remy, love.
I'm trying. I'm also a massive Kent sometimes, but I'm trying.
But that's incredible because I love a Kent with a heart. That's my favourite type of Kent because that's exactly me. Because you can be kind, you can be sweet, but you can absolutely be a shady bitch at times.
Absolutely.
And I love that about myself and every other woman that I love in my life. So I'm sending love to everybody out there. Go and help your dryness and teach the men or women in your life to preheat the oven just a little bit longer, if you know what I mean. And on that, I'm out. Bye, guys.
Mic drop from Mrs. Doubtfire. Mic drop. Oh, I love her.
She's amazing.
She is amazing. She's one of my favourite people on TikTok. She's a lovely, lovely human, and she makes amazing videos. You'll love her videos when she's back doing her videos. You will absolutely, because Kelly's always ringing me for an update on what's happened on TikTok. Mrs. Doubtfire does a daily roundup of whatever happened the day before. You're going to love her videos, Kelly.
I have just given her a follow, so yes, I will definitely drop in on that.
CG, I'm going to let you up, but we are going to wrap quickly, my love. But we are going to wrap because I don't want to keep Kelly any longer. Thank you, Mrs. D. You all right, Kel, for a couple more minutes?
Yeah, I'm okay for a couple. I do have to walk my flowers, and I have got to have a bath tonight because I didn't have one last night.
You didn't do it last night when I was speaking.
No, and then I was all day. So this morning I got up, I was like, I'm getting straight in the bath. And then it was so hot, I thought, there's no point because I've got loads to do. And literally, I've spent 12 hours saying that I've got to have a bath. So I really have got to have a bath. Is the long and short of that.
Fair enough. Hey, CG.
Hello. I just wanted to ask.
Hi, CG.
Hi again. I just wanted to ask one very quick question instead of trying to type it out into 2 lines in the chat. I spoke to my consultant this week. I'm not going to bore everyone else with my long, unrelated backstory again. Ask if I could take some of the things that you'd recommended last time. And he was quite strongly against it. I think while I'm still in active treatment and, you know, for all the red flags that having the big C can cause. But he recommended that to try and control my hot flushes, I could try to take evening primrose oil on top of the venlafaxine I'm on. So I just wanted to know if you recommended any particular type or how to take it or what kind of dosage, because I didn't ask him and I thought you are an expert, Kelly. So
yes, I feel Phyllis should jump back for this. But I always say to my people, I'm not an expert in all these natural things. I do use evening primrose oil. I find it very useful. Go to a health shop and get why can't I think of any of my words tonight? The most natural dose that you can. You don't want all the other shit they add into it. You know, you don't want all the sulfate and the salts and the this and the that. So any good health shop will be able to give you, and I can't think. There is one. I will try and find a screenshot and drop it in your inbox, CG.
Oh, thank you. That would be great. Thank you.
500 ringing a bell, but I will come back to you. But yeah, definitely worth a try.
Because you Google stuff and it's just adverts, isn't it? So it's always hard to know what the real answer is.
I would suggest sending Phyllis Coach a little DM as well, because
I will do.
Because it's not my expert area either, but Phyllis will know. And she might have some alternatives that are similar. Because some people are saying they didn't get on with it, and you might not as well.
Yeah, thank you. I missed most of this evening because I was on swimming duty, so I just gate crashed in at the last minute. But thank you very much anyway, and well done for another wonderful live, Remy.
Oh, thank you, CG.
I'll speak to you later.
Nice to hear your voice, CG.
Bye.
Bye, babe.
Bye.
Bye, darling. All right, I think we're nearly at a wrap. Somebody was saying we should do this again next week, Kelly.
Well, I think it'd be rude not to, really.
Look, if you've got the time next week, and I'll ask Phyllis if she's got the time as well, and then we can maybe... this wonderful...
Are we sticking to the same topic?
They were saying they want another menopause.
Yeah, perfect.
Menopause one.
Let's do that.
But I think, we can mesh it with menopause and hysterectomy, because it seems Tuesday night.
Oh, no. I'm not fussed about that. It's just so that I know if I have to prepare anything, if it's menopause or anything like that, I don't necessarily have to do anything. That's all. See, I would not come unprepared. Even I'm not that unreliable.
I know. But yeah, we'll... Guys, in the chat, right, yes, would you like us to do another menopause discussion next week, Tuesday, or would you rather us do another women's health topic? Tuesday, ladies' night with our foos. Mrs. Doubtfire's a yes, Luna's a yes.
Lindsay said, could we possibly do it on the other app? Is that other app you made me get today, Remy?
Well, I did.
Yeah, that's it.
Yes. So what I intend to do is run it on both apps. The problem is I don't think everyone's going to come from TikTok over to favorited yet. But I'm happy to run it in both spaces. What's this one? Is it crazy? I listen to this so I can understand my mother and partner better. No, it's not crazy, Matt. Do you know how?
I love you, Matt.
Do you know how happy it makes me to hear that you've sat and listened to this live? Because this is so important that men are in here too. You've actually just made my evening right in that. So that you can understand the women in my life.
Yeah, same.
That's amazing.
Thank you, Matt. Oh, big up Matt. Everyone needs to give Matt some love for that. Absolutely. What a man.
Absolutely. And it's not crazy at all. I think it's absolutely wonderful that you've come in here and listened to this conversation, and it will help you with understand. Oh, Melon said Matt has made me cry. No, that's really lovely, genuinely, Matt. Lindsay's like, tell all your mates. Yeah, big up Matt for that.
I'd love to be a fly on the wall for that conversation at work tomorrow. Guys, you'll never guess what I did last night. I grabbed a beer and I joined all these crazy people talking about menopause.
Talking about their foofs and their dry foofs. No, big up Matt for that. We do need more Matts in the world.
Yeah, we do.
Listen, thank you, Foof Wash. Talked about Foof Wash down the pub with his mates. And that was very generalising, wasn't it? Anyway, listen, we are going to wrap. Thank you everyone for being here and being a part of this room, for sharing the live and tapping the screen. Thank you to the mods. And thank you mostly to Kelly and Phyllis for coming and being our resident experts and just offering amazing support to people. And Mrs. D with her screenshots. And once you put a video together, Mrs. D, I'll absolutely share it so everyone can see that. And I'm sure they'll all share it too. Listen to some woman called Mrs. Doubtfire talking about food soap. But right, make sure you're giving Kelly a follow. Make sure you're giving me a follow. And what's tomorrow? Wednesday? Tomorrow
Wednesday.
At 12. We'll do the 12 o'clock live, and then 4 p.m. we got subscriber only live for story time tomorrow. So it's going to be Wicked Wednesday, and I probably will be on Favorited tonight. So if you haven't downloaded Favorited, do that, and you get late night Feral Remy over on Favorited app. Just search for Miss Remy over there. Thank you, Flaps. And thank you.
Oh, wait till I've had a bath at least before you do that, because I'm over there now, but that's going to be what I'm doing tonight, innit? Quick bath.
No,
I've got to go see Feral Remy. But I want to see Feral Remy.
Anyway, yeah, we love late night Remy time. Anyway, I'll see you all soon, my darlings. Thank you all so much, and take care.
Thank you, Remy.
Oh, happy birthday for tomorrow, White Wolf. For your son.
Oh, happy birthday.
21 as well. That's a big number, isn't it? Happy birthday for tomorrow, White Wolf. Lots of love. Right, bye everybody. Thanks, Cal. Love ya.
Bye.
Bye, darling.